All right, it is 7:03. Let me introduce myself. My name is Smitha Hanumantha, and I am your moderator for this evening. I am here to talk about tonight's film called With Love. We will also have a panel discussion on the topic of dementia within the deaf and hard of hearing community. I would first like to thank the Center for Deaf Health Equity, or CDHE, who is led by Dr. Poorna Kushalnagar. I wanted to thank her for funding or for getting the external funding and support for the Deaf Caregiver Health Project. And I would also like to thank NTID for sharing Gallaudet University's CDHE Dementia Caregiver Health film. NTID asked me to be tonight's moderator for the webinar because this topic is very special to me. I am also a deaf caregiver, and I have been for 12 years. My father has dementia. At first, I'll have to admit, when I was asked to become the moderator, I was nervous. I wasn't sure if I wanted to because I felt almost a little bit embarrassed, a little shy. And then I started to realize that part of that influence was based by my upbringing and my culture. As a deaf Indian woman, we often don't talk about this topic openly. We don't talk about it with each other. It's sometimes considered a stigma. And that's part of the reason I feel shy about it. And then I started watching tonight's film that we'll be showing all you. And I was also had the pleasure of talking with each of the panelists. And with all of that, I started to realize how many deaf caregivers there are out there, and especially those who are people of color. And even tonight, we have the opportunity to have this discussion because the discussion of support has been lacking. And that made me realize that, you know what, tonight will be a great opportunity for me to get up. And I'm here to welcome all of you to join all of us tonight to watch this important film and really just to listen to each of the panelists' stories. I would like to use this opportunity to reach out to one another for support and to have real dialogue because, again, resources, support have all been lacking. So this is a great opportunity. So thank you again to NTID and obviously to Dr. Poorna as well, and Stacy for asking me to moderate this evening's webinar. While you're watching tonight's film, I ask all of you to take several minutes to reflect on how we can find the different ways to better support our deaf community members who are out there who have become deaf caregivers for their loved ones with dementia, whether it be their parent, a sibling, you name it. So keep that in mind this evening. Okay, and with that being said, I want to talk about a few Zoom housekeeping rules. I know this evening we will have our presenters, we will have panelists. So take that opportunity as you watch the film and type your questions either in the Q&A section or in the chat. We will have a person moderating all of the questions, and we will make sure that we are vetting through those so we can sign everybody's questions and we can ask the panelists and the presenters to respond to your questions. If there are some questions that are asked that we don't answer, we will find an opportunity to answer those at a later time. I would like to invite Dr. Poorna Kushalnagar, as well as Stacy Lawrence, to please come on screen. Hello and welcome.
Thank you.
If the two of you would like to go ahead and introduce yourselves.
Sure. I would like to take a moment just to explain a little bit about this film and why we've decided to do this film. I am the director for the Center for Deaf Health Equity at Gallaudet University. My name is Dr. Poorna Kushalnagar. And this work is very near and dear to my heart. I know there are many people here on the panel, Stacy, other members here is Smitha, of course, as well. And this is near and dear to all of us. It started with a simple conversation with some deaf women at a conference a few years back. A community member had come up to me, and it just so happened that they became, just last minute, they became a caregiver for one of their parents that had Alzheimer's. Their parent was deaf. And at that time, there were no resources available to support this community member. So I listened to them pour their heart out and just basically explain what they needed. And as a researcher, I wanted to see, how many people do have dementia and what resources are available to support them and support the caregivers that end up taking on the role of taking care of them, whether it be a friend, a sibling, a parent. So I listened and I realized this person was right. There is no support. There are no resources available out there. So it got me thinking, and I thought, well, I could write a grant proposal. I'm very comfortable with that. That's one of my strengths. In terms of, my father had dementia, and I'm not taking care of him right now. He's currently in Tennessee, but I did have experience. I had real life experience, just like this member from the community did. So, this person took the time to come reach out to me, and I thought the least I could do is write a grant and apply for money. So I did, and I received the funding. And with that funding, we started interviewing people and collecting information and data, and it was fantastic. I had a fantastic partner, Dr. Amons. This is her sign name. And she was an amazing partner to go through this process with. She was able to reach out to caregivers who had been placed in an informal role of taking care of someone with dementia. Dementia is a very sensitive thing. And there's a lot of stigmas that come along with that, like Smitha had mentioned, especially within the deaf community. So Dr. Amons she was a great sympathetic person, and she was able to really navigate us through the process and talk with each of the caregivers and get information from them. She would talk to them for hours until they were able to be willing to share their stories. Their stories became very important to our process. I think we interviewed about 22 different caregivers. And at the same time, we were collecting data from really a good number, several hundred caregivers who were able to fill out surveys and such for us as well. So the Center for Deaf Health Equity was able to use all of that information. We wrote a paper last year about caregivers for deaf people and what the life was like in those situations. A lot of these caregivers, they're tired. They need support. A lot of them are asking for resources. The number of Alzheimer's cases is on the rise, and there's just not accessibility. So we need to advocate for our community members who are caregivers. And that's the reason why we've decided to do this work. My connection with Stacy Lawrence started many years ago. I'm a researcher, and I was researching for several years, and Stacy is a filmmaker. So we've had many conversations. So she was able to help me understand the importance of a documentary and how powerful that would be to share stories through film. And also, once people see this film, they're going to be motivated. It's going to touch them in a way that's going to make them motivated to support the caregivers in their community. So I really, tip my hat to Stacy, because her work is so important, and all the work that she put into this film has just been amazing. So I'm going to turn it over to Stacy and let you share a little bit about your story about how this film came to be.
Wow. Thank you so much for asking me to be here in the first place. As everybody mentioned, this is a very valuable and personal project for me. I was a caregiver of my father for about 16 years, so it is very near and dear to me. This project is invaluable I would like to point out with this project that we have had a wonderful team on board, wonderful people who have been working behind the cameras. People who have been behind the cameras are the younger people. And you might wonder why we work with them. They are the next generation of advocates, and they will be advocates who we as caregivers need. Like what Dr. Poorna was saying, we are tired, and that's a truth. And the young cohort of people will be a very important people that we'll have. Hunter Luther, who helped film the interviews. Oh, just an amazing asset. Just saying, yeah, I mean, Hunter had to take care of his mom, somebody who recently graduated from RSD. Darian Slattery also, who was an RIT graduate. Oh, Darian loves stories. And just being able to watch the stories in ASL and realizing the power of storytelling, especially sharing it in ASL. All of that is so powerful and it is so important. We even had 2 high school students, Chloe and Spencer. The 2 of them were doing some of the color editing. And so it was all a team effort. And that collaboration is key, especially when working with individuals who are senior citizens in the deaf community. There are, yes, many people who are caregivers. We are caring for loved ones, but a lot of us are caregivers for community members as well.
Absolutely.
All of this is very important. So that is something to keep in mind while watching the film. And so I could talk forever about this film and the interpreters who were involved with this project. I can't even begin to thank them. Frank and Eileen Todesco, who are the 2 in the film, signed beautiful ASL. And just the ASL is rich. And I almost have to, make fun of them. And of course, with love. And the interpreters had a little bit of a hard feeling about it. And I said, hey, that's how Italian families do it. They make fun of each other with love. So, without further ado, I would like to ask our alumni relations to open our film. Thank you. And thank you.
Yes,
both.
thank you to both of you.
She had started to become more and more forgetful.
Yeah, it was the early onset of dementia. It wasn't like 2 or 3 years or anything. It really happened all in July.
I must practice letting it go. I was starting to feel overwhelmed. Wow, the brain actually shrinks? Mom was worried that I would put her into a nursing home. I assured her, no, Mom, I'm going to take care of you. Just like Mom took care of us, it's our turn now.
Right.
I want to continue taking care of you. She said, you don't have to come and visit me. Why? I can take care of myself. I had to tell her, no, Mom, you can't. But she doesn't listen to me. I've just decided to let her think what she will.
We have to find the humor in these stories.
I have to take care of myself or I'll lose my mind.
Yeah, what makes it easier is that we all love Mom.
My father had a stroke. It was probably 13 years ago, right?
Yeah, it was in 2007.
Yeah, so 13 years. Yeah, I've been going back and forth to Philadelphia to take care of everything. And when my dad passed, I had to take care of my mom. More and more, the disease had started to take over, but I hadn't recognized it at first. When my dad had the stroke, Mom asked for help writing checks. Seriously, I thought you knew how to write a check. No, your father was in charge of everything. Ooh. So I saw what we were up against and was willing to help. And my sister Rosemary hadn't been aware of the situation either. She's good at math too. And we decided I would take over Mom's affairs. We were ready to have Mom move in with us, and she said no. And that's when I really took notice of how much she was changing. That was last year. I think it was around Thanksgiving. But really, over the course of the last 3 years, she had already become forgetful. Sometimes, she would accuse me of stealing some of the things she kept upstairs. I was always dumbfounded, and every time she'd go upstairs in a huff, that always spelled trouble. She would come downstairs later, a completely different person. I'd say, Mom, what are you talking about? She'd say, I know you stole something from me. Come on, give me what you took right now. What? She'd respond, you're a thief. You're a thief. You took things from upstairs. I'd ask, okay, Mom, what did I take? What? She would say it took a bunch of different things like makeup, money, toothpaste, bracelets, watches. And tomorrow it'd be a different list of things I'd stolen. She'd go upstairs and then come back behaving like a different person. 2 hours later, she'd go upstairs and change again. And that's when I realized that's not my mom. When all this started, I would share all of this with my wife. She would listen patiently as I told her the stories.
Right. I started to see it for myself by observing her behavior, and everything matched up, and everything was Alzheimer's. And I thought, so I discussed some of this with my friends who are taking care of their parents too. And as I asked them questions, it all kind of matched. It was the same. So we kept encouraging Mom to go for some testing at the doctors.
She refused.
Yeah.
And I would explain everything to the doctor, but we had to communicate by writing notes back and forth.
Right. In Philadelphia, the interpreting access is Rochester here, we've got wonderful interpreters, but Philadelphia doesn't have the same. Now, your mother's doctor's office is a very small office. They're not familiar with ADA laws. And so we're really trying to work out that problem.
Our family had gone to the same doctor's office for almost 60 years. It was close to where we lived. You know how it is right in the city of Philadelphia. Everything is within walking distance. The doctor's office was just a simple walk, maybe 4 or 5 blocks from home. And since she'd been going there for 60 years, Mom would say, I can lip read the doctor. Oh my goodness, Mom would always say, I can lip read. Don't worry. We had this conversation over and over again.
I'm used to lip reading. I did not sign much. Now I sign fairly well, but I lip read more. Ask him.
I wrangled with the doctor's office, and they kept saying they couldn't afford to hire an interpreter for us. So they suggested that we consider switching doctors. But my mom was adamant that she wanted to stay. I called the doctor through an interpreted video relay. I explained that Mom was forgetful and she seemed to have dementia. And that's when the doctor started to pay attention. And I said I should bring her in. I explained that for communication to take place, we would need an interpreter and that writing notes wouldn't cut it. The doctor insisted that there had to be an in-person visit in order to make a referral. So I ended up calling my daughter to help us figure things out. I mean, my daughter was willing to do so, but the appointment kept getting postponed because of logistics and coordinating everything with her.
Yes. And then in July, something serious happened. A friend of mine called and said, "Hey, I can't get a hold of your mother. I've been trying and trying." And I thought, So I tried texting and doing the same thing. Frank text, my daughter text, Rosemary had been trying to reach her. So everyone was trying, and we were really concerned.
It was 100 degrees upstairs, and she had just been lying there this whole time. Meanwhile, everybody was trying to contact her, and she wasn't answering the phone nor the door. The neighbors were all looking for her. We were all worried. The doors were locked. So the next door neighbor brought over a crowbar and broke the lock on the door. Was finally able
Now,
to get
mom was
inside.
upstairs laying on the floor with no air conditioning, just nothing. And mom was just covered in sweat. And she was immediately taken to the hospital. And then we explained to the ER doctor that she has fallen 4 times already. And we filled them in on all these other things that were going on. And so they went ahead and decided and said, let's do a CAT scan. And after that, they diagnosed her with pneumonia, dehydration, and at the same time, they confirmed she had dementia. And we asked, how could you tell it's dementia? And they said they can see the scan of the brain was shrinking. And I thought, oh, I learned something. And that's how we found out, right?
The brain is getting smaller and smaller. After that discussion with the doctors, right then and there, I became completely overwhelmed. And then numb. My daughter was taking care of everything, managing the interpreting and connecting us with the right people. I was feeling useless because it all started to sink in. The brain actually shrinks? Interesting. That would explain her recent behavior. And still she was saying, why am I here? Why am I here? I'm just fine. I'm fine.
We tried to explain to her really carefully, you didn't drink enough water, you're sick, you have pneumonia. And she, taken aback.
She's a very hot, strong, and high energy woman.
Definitely a strong woman indeed. Very strong woman. She really is. But at the same time, the doctors were just straightforward with her and said, you have dementia. Yeah,
And
she didn't get
understand. She asked us what it meant. I said, well, you keep forget things a lot. And she said, I am not forgetful. I am not. Ooh, this is going to be tough. The doctor came in with a social worker. I think it was a social worker. They tried to force us into putting her into a nursing home. And I said, absolutely not, and started arguing with them. And our daughter also got involved. I insisted that she come and live with us. And I had to prove I had power of attorney and some other stuff. Unnecessary. Mom could totally join us. I did not have any energy.
Fortunately, after your dad died,
what a headache.
We went and saw a lawyer, and he suggested that we get a power of attorney to prepare for mom in the future. Now, once somebody's diagnosed with dementia, they can't officially assign any papers, so not even a power of attorney, because in the eyes of the law, they're deemed incapable. And so they're not even able to. So lucky thing, fortunately, that Frank, he already taken care of this in advance, and he signed everything. He had the health proxy signed, and just the formal test results came back and confirmed she had dementia. So Frank had all the legal documents prepared for his protection.
What a headache. It was a headache, but you know what? Thank God for my wife, because she did all this for me. I was clueless. I am not adept with English.
Right. Well, you're good at math. I'm good at English. You're a finance guy, and I am a researcher. So there you go.
Perfect.
It's a teamwork.
Hiding everywhere.
That's mom. That's mom. For example, one of the signs of dementia is that you hide things and you blame other people for things you can't find. And I quickly would have to look high and low for them and give them to Frank. Fortunately, the lawyer had the original copies anyway, so made copies and gave them to Frank. And once we had everything, we gave him to the hospital. Mom could finally be discharged.
doctor and the social worker visited and said, don't bring her back home. Take her directly to Rochester. And I was like, you mean from the hospital? Don't stop back at home? At the house? They said, nope, go directly to Rochester. Bring everything with you. I was reluctant, but I agreed. I ended up getting a U-Haul and carefully chose what I thought would be most familiar to her, which were her bedroom items. That's all. Rosemary's son, my nephew, and my son and his husband, and also my daughter Carrie, all worked together packing up all of her things. Once everything was packed up, I drove the U-Haul and we caravanned over to pick up my mom. And we headed directly to Rochester. Two days later, my mom thanked Kari for bringing her here. She expressed her gratitude to Kari again and again. I said, hey, I was part of this too. And mom said, no, you didn't. You didn't. It was just the two of us. I said, Mom, how do you think you got your bedroom stuff from Philadelphia to Rochester? I took everything with me into U-Haul. She accused me of lying to her. I countered with, but Mom, how did you move everything? She said, well, we put everything in my car.
Oh, Frank is wonderful, a good person. He helped me a lot when I was sick in Philadelphia. He drove back and forth to help me. He drove back and forth to take care of the house, too. Back and forth.
No, you didn't, Mom. How could you fit everything in your car? It's way too small. And I realized I had to take Eileen's advice and learn to just let it go, let it go. I had to learn that lesson because arguing with such a stubborn lady gets you nowhere. Mom got it into her head that all of those times I was commuting between Rochester and Philadelphia, I was looking for money. Mom said, Rosemary is plenty smart. And she doesn't want my money. I told her, now be reasonable. She said, I know you were trying to get my money. And now that you've got me here, you're going to rob me. I said, how? How? I pay all your bills. I take care of you. I do absolutely everything for you. But she will argue forever and never budge. Again, I have to practice letting go over and over again just to keep my sanity. Sometimes Mom makes rounds in the house and comes out of the bedroom and says, where's your father's ring? Again, I am always so shocked and remind her that the ring went with his body. She would say, you took it off from him and you kept it. We go back and forth about that. Me insisting that he was wearing the ring when he was cremated. Her saying she knew that wasn't true. Once again, I just had to say to myself, let it go, let it go. Man, it's tough. In the morning, I get up and prepare Mom's medication. Eye drops for her dry eyes, which give her a lot of trouble. 6 different medications and vitamins in a cup. And on top, 1 for her throat. So when she comes into the room, first thing I do is hand it to her. She complains about having to take 3 vitamins, and I remind her it's the same every single day and has been forever, but she insists no, that she's only supposed to take 1. Next day, she'll say there's not enough vitamins. And back home in Philadelphia, she would take 6 vitamins.
Right, but that number always changes.
6,
6,
5,
7, or
7.
5.
She's obsessed with her vitamins.
Mm-hmm.
We brought her hope chest when she moved here. It's been in her family forever. My grandparents had it and gave it to my mom. And inside, there's a set of antique silverware. Silver. Mom got so upset when she saw them. Where are the gold ones? I had to remind her that there never were any gold ones. She brought it up again and again. That particular obsession persisted for months. Again, patience is the name of the game. Not long ago, my mom said, "You sure are a clever one. You dyed the gold silverware to look silver." What? That's the new spin on things. I said, "This is all in your imagination, Mom. I didn't do that." She said, "You can't pull a fast one on me. I'm not stupid." She just could not get it out of her head. I give up. She can think what she will.
Yeah. Again, we have to find the humor in these stories. We have to.
My mother used to be so open-minded, very accepting, but now she's become so intolerant and against things she wouldn't have cared about before. She'd forgotten her previous attitudes. My daughter is lesbian and married. My son is gay and married. Mom started to make discriminatory comments, and I had to remind her that her beloved grandchildren are gay.
I'm not against gay marriage. It's their business, not my business. They're happy with what they want. I refuse to criticize them. Their own business. I refuse. Why the need to criticize them? That's what they want. Right. Today, everybody is gay. Leave them alone. Leave them alone. Leave them to God.
She forgets her previous attitude of acceptance. She's not the same as before.
And you have to let go to live in her world, so to speak. Because
it's not my mother.
Yeah.
I promised my mother, when my father had his stroke, that I would not put her in a nursing home. Shortly after my father's stroke, my mother said, "When he passes away, you're going to put me in a nursing home?" And I said, "No, I would take care of you. Don't worry. You're thinking too much about the future. Calm down. That's a long time from now. Just
Right.
relax."
Remember when your father did have a stroke, he was put in a nursing home.
Yeah, we saw what that was like.
I mean, that nursing home was a bad experience. And then when you brought him home, you both took care of him for 2 years.
They had my father basically parked in the corner of a room, staring
in
at
the
a blank
nursing
wall,
home.
oblivious
That's
to
what was
any
going on
activity
over
going
there.
on behind him in the unit. I lost my mind. I was enraged at their treatment towards my father. I mean, what is wrong with you people? You wheel him into a corner, hands placed in his lap, and just leave him
Right.
there? It looked like he was being punished for something.
So, yeah, and he was the only deaf person there.
Yeah, my dad was
deaf.
the only deaf person in a nursing home with all hearing patients. My mom insisted we get him out of there and said, "I promised him when we got married I'd always take care of him. He's coming back home." She did a good job too, even though she's only 5'2", and my father was a tall guy. The physical therapist and I tried to reason with her. "Mom, it's too much for you. You can't handle Dad alone." She kept saying, "I don't care. I don't care. He's coming back home, period." I knew there was no way of convincing her otherwise, so I honored her wishes. Communication is essential for deaf people. How can hearing nurses talk with a deaf person in the dementia unit?
I like home. Lots of friends there. Wow. Yeah, lots of friends. Deaf club, where deaf citizens there. Deaf, I like it there. Here, I don't know.
She took care of us way back when.
That's
And
right.
now it's our turn to do the same for her. She's always been so good to us, so caring and giving. And now we give back to her.
It's really important that we just love Mom. And that's what helps when things are rough. We love Mom.
Yes, love, love, love you. Love each other. Mm, 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 mm.
Okay, is the spotlight on me? All right, great. Wow, that is just a powerful documentary. I hope you all enjoyed it. It really hit home. So I want to thank all of you for the wonderful questions that I see coming up through the question and answer. A lot of them, this is about the caregiver's experience. I do see a whole bunch of questions related to dementia and symptoms of dementia, and we're going to try to answer that from a caregiver's perspective. But at the same time, we strongly encourage you to, meet with a neurologist, get an evaluation, and get factual information from doctors and experts. If anyone has any questions about the film for Eileen or for Frank, go ahead and put those in the chat right now. So I would like to invite both Eileen and Frank to turn on their screen and join me here.
Hello.
All right, great. Hello, both of you. Welcome. How are you guys doing? All right, great.
Doing pretty well.
Really, this film, you both, it was so powerful. And I've seen it several times now, and each time it just gives me the chills, right? It's probably the same with
Yeah.
you.
Honestly, it's a tearjerker.
So this film, let's see, it was created back in September of 2020. So it's been about a year and 4 months at this point, and I'm curious, could you guys share an update with us? Any changes in your process, in your journey? What's been happening with your mom? What can you share?
So this
Yes,
film
this.
was
Go ahead,
created
Nicole.
in January of 2020. So during that time, our mom had been on medication, and when the film was made, she was not on any sort of medication. However, her behaviors did continue to escalate because of the dementia. It did become a lot scarier to the point of where we needed to medicate her. The medication has helped. Her behavior has calmed down a bit, but she is, as being an Italian woman, she is very loud and she can have, speak a lot. And she is a little bit aggressive from time to time.
Okay. the medicine definitely did help. And, you know, there are services here in Rochester. I think it was, oh, yes, it was in July. We brought her here from Philadelphia to Rochester in July. So there was some, you know, definitely some confusion for her. So it took until about October for everything to really settle down. And we had to make some adjustments with her medication to get everything regulated. But still, you know, we noticed we wanted to wait a little bit and make sure that her symptoms were getting a little bit better, a little more manageable, and so that she could calm down and get used to the new life here. But still, you know, she's just all over the place. She became a lot less assertive, a lot less aggressive. But at the same time, it just seemed like there was a lot more confusion with her. Oh, I completely understand. I mean, I've had the same exact thing taking care of my father as well. The mood swings that would come up, you know, he'd kind of blow up from time to time. But my father was also diabetic. So we had to make sure that we were managing his medication to control the diabetes. So, you know, with the mood swings and everything else, we had to make sure we went to see the doctor and made sure that the medication was the correct one for him. And once we got the right medication, it made a world of difference. And also, you need to make sure that you have ongoing visits to your doctors and your providers as well.
Absolutely. We did have an individual from the nursing home who comes 3 times a week to take care of her. It had been a struggle. We had been reaching out for a long time.
Yeah, for quite some time, there was no one available. And I feel like, you know, it broke me. I just needed my own time to exercise and to, you know, to not be on 24/7.
Absolutely. While caring is important, you need time for yourself.
And also just with communication. That alone was very interesting. Let's see, it was in September was when the person first came, and it was a young girl that first came. She was really motivated. She really listened to what we needed. And, you know, we threw a lot at her, but she learned a lot. And now, you know, my mom started teaching her. And, you know, she was kind of taking advantage of the situation a little bit. But back on December 24th, that particular person was laid off.
Unfortunately, we didn't know why she was laid off. We were really disappointed.
So we got somebody new that came in, and, you know, we exposed her for one day, we watched her just to see how things were going.
Yeah, we did a training with her.
Oh, this poor girl was so overwhelmed. And it was a complete opposite. She, you know, wasn't as eager. We kind of had to make sure she was in there, you know, she just looked like a deer in headlights. We had no interpreter, and oh, that poor girl. And she never came back again. They did let us know, the company did let us know that that particular person decided it wasn't for them. So, you know, we had to kind of wait for someone else to be assigned. And then it was like another 2 weeks or so.
Yeah, I want to say it was about 2 weeks ago we had somebody.
Yeah, it was just 2. Oh, so this just happened just recently. Yes, we kept writing, but they kept saying they didn't have anybody. They didn't have anybody. But my mother ended up falling. And so we made sure that, you know, they had a lot of rest, that they want to make sure that we weren't going to be taking advantage of anybody. And I realize it's really hard to communicate with my mom. You know, yes, she'll say that she can read someone's lips and she understands what they're saying, but they don't understand her. So, you know, it's important that we're teaching the person that's coming in to help her, that we're teaching them some sign language. And so, you know, the person that we have now is, you know, a great person. She does a really great job. But, you know, what are we going to do?
Wow,
Okay, so it seems like I have a lot of questions coming in from the audience. So I just want to take the time to ask you a few of those. So the theme of letting go, that came up in the documentary. And I'm wondering, has that become easier for the two of you since 2020, or do you think that it's gotten worse?
I would say about half and half. The idea of letting go is tough because I am letting my mom hold on to whatever it is that she believes, but it does escalate. And sometimes it is hard to keep my patience. And well, for somebody else, it might seem trivial, but for her, whatever she has in her head, she's stuck with it, and it does affect her mood. It is really hard to
Also,
deal with.
he's the son when you think about it that way. All right, I have another question. Since your mom is living with you, do you have you added any locks to the doors? What happens if she takes off? Have you had to add any locks to doors or any other safety type things?
Yes, we do have cameras that we have installed in the living room, and those have pretty a far stretch. So we're
That's
able
smart.
to see, and we also have it outside. We do have a ring camera for outside of the house, and there is an alarm that will alert us if there is movement in the garage, and it is also there for the front door. We haven't installed it quite yet, but we plan on having a vibrating device underneath the bed. And so the way that our beds are situated, it will be hooked up wirelessly. So if mom gets up out of bed, it will alert us in bed. And so we'll know to check on her. So that will be installed
that's great.
relatively soon.
That sounds great. Smart.
And we also have lights that were installed in the house too, that will shine at night if she is up and about at night. And sometimes if she is walking in the middle of the night, we're able to spot her because of that.
So there are a few more questions here for you in the chat. Would you mind talking about finding a caregiver? And then you spoke briefly about finding a caregiver and then having to find another one. It seems like you have gone through quite a process with your mom. How did you go about finding the person that was just recently assigned to you in the past 2 weeks?
We actually worked with Lifespan, who is an agency here in Rochester. They work with other agencies. In addition to that, we worked with a social worker. It's somebody who works with our family doctor. We also worked with a neurologist.
Oh, it's so important to have a team. Yes.
Yeah, so we did have different services. So between the neurologist, the social worker, and Lifespan. Lifespan, again, is a separate agency, but they kept us in the loop when they were searching for a new caregiver for my mother at home. And again, this was a 2-year process. And because of COVID, that completely ruined our chances of getting somebody right away. Everybody was booked. It was very hard to find somebody to work at home.
Absolutely. It's so hard to find someone. We have another question related to cost. Does your insurance cover the payment for the caregiver? Or is that something that you pay for out of pocket?
Yeah, unfortunately, no, it's all out of pocket. It's actually mom's, money that is going towards that. She had money saved for a long time, so we are very lucky that she had that. But at the same time, it is a significant cost. Looking for somebody for 30 hours a week. We did find an agency that had a reasonable price they have a minimum of 3 hours. You can't have anything under 3 hours. So we felt that was reasonable. And it
has to be a minimum of 3 days as well. But it's required to have someone for 3 days.
Right. And that's what the policy was for our agency.
I'll have to admit, the cost for caregivers, it tends to be quite expensive. And it's not easy to find someone for a reasonable cost, especially due to COVID and everything else. The price of everything has been going up. So I agree. Okay, so I have 2 more questions left. Oh, go ahead, Frank.
Oh, and you know what? The money I don't care about. What's important is my mom. Things like her being comfortable bathing her. I'm not comfortable bathing my mother.
Yes, it's the quality of life that's important.
Right. So I don't want her to get upset with me for me trying to bathe her. And even for Eileen to do it, I need somebody who has a license, somebody who has the training.
Yes, that is key.
It's very important. So even doing something like bathing, well, it's such a basic life thing. We need somebody to help with that.
Oh, I understand completely. I think we are on our, let's see, fourth caregiver. Someone would show up, the communication just would not go smoothly. Person might seem a little bit lazy, they weren't doing their job, and we had to constantly remind them. So I understand completely. Okay, I have one last question for you. What has been the most helpful thing in your journey as a caregiver? I remember you did talk about this previously, and I noticed one thing about the two of you is that you have such great humor. You have to have a sense of humor. And I've noticed that that's something that just seems so important. You guys tease each other, and in the film as well. You were kind of teasing your mom a little bit, and you have to just lighten up the situation. And I totally agree. It has to be part of the mix.
Oh, humor is very important. But what also is very important is support from our family and our friends. Luckily, I am connected to different Facebook groups. Unfortunately, it is with hearing people, but they are other caregivers of loved ones with dementia. And I've taken some of those tips and tricks and tried it with Luis, but having that support has been extremely important.
Oh, I completely agree. So it's time to wrap up this part. But one thing, in terms of being a caregiver, that's a big job. How do you find time for yourselves, whether it be, going to the gym or doing anything that might fuel your spirit? How do you do that? How do you balance that?
Mornings seem to be better. I like to go to the gym in the morning. When it's in the afternoon, oh, forget it. Mornings are much better. Then I have time for me. Being able to just relax after a long day of being out and caregiving is also really important. Even going out grocery shopping has been a godsend. And then it gives me that patience to be able to be with mom. And in the afternoon, we'll go take a nap. I can look over her. And so I get to do stuff while she's napping.
Yes, you've got to take care of that nap time.
And at night, even though since Frank is working with mom a lot during the day, Frank will do things like online poker. And once I'm done working, I'll take care of mom at night.
And that's essential, just families being able to support one another through the process as well. I just want to thank both of you for your willingness to share your story and just open up about your journey about being a deaf caregiver. It's not always easy to open up to the community, but I think that your film will definitely make a huge impact. I want to thank you for this conversation and for starting the conversation on where people can find support within their own situation. So thank you so much for your time. This has been wonderful. You can go ahead and turn your screen off. Okay, great. So now I would like to use some time just to basically introduce our panelists. So panelists, could you please turn your screens on? All right, great. Wonderful.
Hello.
So this is our panel, and I would like you each to take the time to introduce yourselves. You can start with your name, your SVP year, when you graduated from NTID, or what role you had within NTID, what connection you had to the university, and how many years you've been a caregiver. So who wants to start? Any volunteers?
Sure, I can start. My name is Chad Ludwig, and I live outside of Salem, Oregon. I've been a caregiver for my mother, who is hearing, for about 17 years now. I also have a full-time job at the same time. I work at Western Oregon University, as well as a nonprofit agency as well for Brindle, Oregon. I'm SVP 91. I graduated in 1997 and went off and did my own thing after that.
Great, thank you so much. Let's see. Russell, would you mind going next?
Sure. My name is Russell Frank. I'm actually here in Rochester, New York. I was a caregiver for my father. His name is Jeffrey. He was SVP, 78, And my mother was SVP 82. And I was a caretaker for my dad since about 2013 until 2021. Unfortunately, he passed about a year ago. He was in Columbus, Ohio. I was taking care of him there, and now I'm back in Rochester. And I really appreciate all of you making this film and that it's now a resource for a lot of community members.
Absolutely. I'm so sorry to hear about your father. Thank you for your willingness to be here and share your story.
Sure, of
Okay,
course.
so lastly, Sally, would you mind introducing yourself?
Sure. My name is Sally Taylor. I was not an SVP student. I might be a little bit too old for that. However, I worked at NTID from 1977 until about 1999. So about a 22-year career there. I knew a lot of students who came in, and I was part of the outreach support team, and I worked there as a secretary. I was the only deaf secretary at that time. And then I became a part-time instructor as well for general education classes. So I know some of you who are joining us tonight. Chad, I think I saw you come into the office, make some copies. I was a caregiver for my husband, Paul. He also used to work at NTID. Many of you, I'm sure, know him. He worked in the computer technology, the ACT department is what it was called. I forgot the official name for it.
Yes, it was applied computer technology.
Yes. So we lived in Rochester for many years. And then when Paul and I retired, a few years later, Paul decided he wanted to move out west. And, we had 3 kids and they had their children as well. So we wanted to be able to get to know our grandchildren better. So we flew out and, we would only communicate briefly. It wasn't very helpful for me. I had 10 grandchildren and we didn't really talk too much. It would be a brief hi, and then they would leave. So then we decided to move out to Portland, Oregon. And that's where I'm living now. So I've been here since 2013. About 4 or 5 years later, Paul started to have some symptoms. I would say the first one that was one of the most difficult is that I went into the computer to check our finances. And again, he taught computer classes at NTID and he couldn't even get in his computer. It was so sad and so frustrating to see. Then he tried to talk with me, and some of the words that would just come naturally to him were no longer there. And so I would have to start feeding him some of the words that he used to know and used to use regularly. I noticed he started walking slower. He wasn't as responsive. He would become easily frustrated because he forgot a lot of his language. And just over time, it progressed until essentially the last year, it became so horrible that, I couldn't really be his caretaker as much. Really, the first 2 years were almost funny. We love to be in the kitchen and make something. And, I would have to remind him, oh, it's time for breakfast. And there were just a bunch of different types of food. And, most of it was sweet stuff. I do love some sweet breakfast. And then he would also go outside, just walk around, but he wouldn't let me know. And I would have to sit in the TV room and have to watch him. He would get up. I was assuming he would go to the bathroom, but then he'd be up and he wouldn't come back. And I would be scared, but I would find him outside. Luckily, we had great neighbors who would text me and say, I think I saw Paul walking past the house. So I'd have to get up, run out and grab him. And that's when my daughter decided to get him a bracelet with his name on it. And it explained on there that he was deaf and has dementia. That was actually quite helpful to have. And then he started opening the door and leaving. And the light that we had, I don't think was working. So I had to change the locks, unfortunately. I had to lock it with a key and then hide the key so he couldn't leave the house. And he would come up to me and be frustrated, and I would just tell him that I would walk outside with him. And by the end of the third year, he did pass away, by the way, last January of 2021. So we just had his last week, our 1-year anniversary of his death. And that hit me hard. I have been managing it okay until this month. I really do miss him. We were married for 57 years. So
I'm
anyway,
so sorry to hear that.
yeah, the last year of his life, he was having a lot of issues communicating. We'd be watching TV and I'd ask him, tell me what's going on this show. And he couldn't explain what was happening. He'd read the newspaper, but he would just be sitting there while he was eating his breakfast. And I would ask him, hey, what's in the news? He wouldn't know. He couldn't explain anything. He kept himself busy. I mean, like I said, he stayed reading the newspaper all morning, which was great for him. We got to the point where we definitely needed to go see a doctor, and they did tests on him, and he had mild cognitive dementia or mild cognitive disorder. And that was sort of the beginning. And right away, when that diagnosis happened, my daughter put an advertisement in the paper for somebody to come watch him for 2 or 3 hours a day so I could have a break and so I could get out. And at that point, I had met a deaf nurse or nursing aide who signed. She had a cochlear implant, and she came by, and, I thought it was going to be great because she could communicate with him. And she also understood that with dementia, he wasn't able to say all the words that he wanted to. And she was so patient with him.
Excuse me for interrupting, but, you said you found that deaf nursing assistant, but how did you find them?
She answered the advertisement that my daughter put in. I didn't know her. I had met other people after that who said, oh yeah, I had know of her, but yeah, I want to say she was in her 50s. So she had been working for quite a few years. But yeah, what was I saying?
That you found the deaf nurse's aide, and that she responded to your ad and ended up coming to your home.
Oh, right. Yeah. So she came and worked with Paul for a few weeks, and she had warned me that she was applying for another job that had benefits. And so unfortunately, she was only with us for a little bit of time. We were able to pay her with our long-term care, but unfortunately, we couldn't afford to hire her full time. We were relatively disappointed, especially because, she got the job that she had applied for, and a friend of mine volunteered to come over and take Paul out to lunch and just spend some time with him. There was another, deaf guy who would come as well. His name was Felix. His mother had dementia, so he understood, and he was also deaf. And so it was nice having that sort of man-to-man time together. And we got to the point where Paul needed more care. And I happened to get a call from the first caregiver that we had. And she said, hey, I quit my job because of COVID. I can't understand people with the masks. I can't communicate with people. It is much too hard at work. It's a hearing agency. And I asked her, can you come back and work for us? And she said she was ready. So she worked with us for, I want to say, about 30 hours a week or something like that. But she was extremely helpful. And she was able to tell us what to do because, where we should go for help. And we were able to find a support group. There were 2 other women who had husbands who had memory loss.
So how did you find those support groups?
Sure, yeah.
Because I want to make sure that we are able to ask the other 2 panelists as well, how they were able to find support groups. So once you're done, I'll switch over to Chad and Russell.
Yes, we called the Alzheimer's Association. They had support groups there. So I asked for an interpreter to attend one of the meetings, and they did have one available. So they provided interpreters. I felt very fortunate for that. The Alzheimer's group was a little bit familiar with individuals who are deaf. naturally, they were both still a little bit awkward, and I did help them and ended up working out smoothly. But, we got to the point where Paul couldn't communicate. We had to essentially split the group. So we would have a person with dementia, and then in the other room, we would have the caregivers. We would have to have separate meetings, and they came and told me that Paul couldn't express himself anymore. So he stopped going. And then Michelle, who was the nurse, came, and again, having her was great. The past, or the last maybe 4-6 months, he declined quick. He couldn't walk. And by December of 2020, it was Christmas Eve, actually, we did have him assessed, and he needed hospice care. He couldn't walk anymore. He was eating a little bit, but Michelle came and helped us a lot. We had, there was a caregiving program, I want to say, not in Rochester, in Portland. I'm trying to think. So somebody came and took care of Paul. I want to say it was 2 times a week. They would bathe him and do all of that. And they would always bring an interpreter with them.
Oh, they brought an interpreter with them? Wow.
Yeah, they took
That's
care
rare.
of that themselves. They were doing as much as they could for us because they loved me and Paul, of course. But yeah, we had interpreting services for the home visits. Everything worked out beautifully for us. We asked and they gave it right away. I would say Portland is pretty close to being as accessible as Rochester is.
That's good to know. It's good to know there's support out there in the community.
Yeah. And again, he passed away January 11th of last year. So yeah, it's been a year. I miss him.
Wow, Sally, thank you so much for sharing your story and just the process from the beginning until the end. That was a tough journey for you. So thank you so much for sharing and being open to sharing with us. So I want to turn over to either Chad or Russell, either one of you. Would you mind if I started? This is Russell. Sure. Would you mind sharing, your thoughts about the film itself? What did it make you think about? What can you reflect on? All right, sure. I feel like the movie was very relatable. Frank and Eileen's story, pretty much very similar story to what I went through with my father. Just the mood swings. At first, my family thought that, he might be bipolar just because of his severe mood swings. That was in 2012. And we noticed that he was forgetting little things, like where he put his keys or how to write sometimes. Sometimes, my father was, great with English, but sometimes his grammar was off when he would write something, or there'd be words missing and such. So, we thought maybe he needs to go to the doctor. So, after some convincing, everybody's situation is different, but we ended up taking him to the doctor in 2013. And that's when he got the formal diagnosis of having dementia. So once he had that label and that diagnosis, the film is exactly what we went through. Do you know that, that term about someone walking in the middle of the night and sleepwalking, and they get up and everything just seems off? So those kind of things were happening. It was very frustrating. We'd keep telling him go to sleep, but he wouldn't sleep. He would just be wide awake and really struggling to sleep. So it's a struggle.
So you found yourself relating to a lot of little things in the film.
Oh, so many. Yes. And just through the frustrations. I agree with Frank and Eileen. You've got to have humor and you've got to have family support as well.
Oh, you had that with your dad as well?
A little bit. My father was well known for his humor. So, that was just part of our life. It makes life easier. So we just kind of went with that. But we had a lot of support from our family. And I was really fortunate because my brothers and sisters and I were able to take turns supporting him, because otherwise we would have been burned out. So just being able to take turns with that, and, everybody was able to have a bit of a break. So that made it a lot easier. At the very end, when he was in hospice care, we decided, I think it was someone came twice a day just to help him with whatever needed to be taken care of. And then that very last week was more. But before that, my siblings and I took turns taking care of him. And I was really thankful for my family being able to be patient with one another and being patient through that process. There are two keys when it came to being able to take care of him. One of them was Medicare, just for financial reasons. A lot of the doctor's visits and such were covered. And once he was given the diagnosis, we had to go to many different doctors to make sure everything was okay, maybe to change medications, maybe one particular medication wasn't working anymore, so we needed to try something new. And Medicare covered all of that.
They covered the cost of the caregiver as well?
Not that part, unfortunately. But we decided just to take care of that on our own. The hospice part, some of that was covered. Another part, we were able to use some of my father's retirement money to take care of that, but we were so fortunate. So Medicare was one big thing that helped us out with resources, and another was a social worker. And we were so grateful to all the support we received from the social worker. We were able to call at any time. It was through the Alzheimer's Association, and they were able to partner with us and answer our questions. They were able to help us get hospital beds that had 4 wheels. Yep, they brought it right to us. Yep, it was very nice. They brought it right to us so we could set it up in a very specific room for my dad to make it easy to care for him. So it made everything so much easier. I mean, to be honest, without them, we would not have had as good of a situation as we did. The Alzheimer's Association really helped us quite a bit. So social workers, I would definitely suggest that. Also, just having a good attorney to take care of the power of attorney such, because you need that type of thing. And also, there were some complications, and, the social worker was able to help us with that and explain everything that we needed to know, what documents we needed to sign. And I mean, when I was watching the film, I felt like that was my life. Like, I related to so many different aspects of the film.
Yeah, that film was done intentionally to create that connection and empathy with our viewers. So I 100% agree with you.
Oh, and I'm so thankful for the filmmakers. All right, I'm going to let Chad have a turn now to answer as well.
I do have another question for everybody that everybody can contribute to. But before that, Chad, if you want to tell your story real quick, talk about your thoughts and reflections on this film. And again, I have 2 other questions, but yeah, we'll start with that one first, and then we'll go into my second question. So when Stacy had first created the video and they wanted me to watch it, I had to stop. I couldn't watch it anymore. I had a chair next to me today and I watched it all the way through. And of course, my eyes were welling up at certain moments. My mother is 71 now. She was 58 when she started having, noticeable symptoms. She couldn't drive anymore at about 59. She had her license revoked, her car revoked. And so her independence was essentially gone. Her autonomy had completely changed. And she aged very quickly after that. So we are here together in our home, and we built a home. This actually has a mother-in-law suite connected to it, which has been very nice to have. She's right there next to me. So it's nice because it is separate from me, but she has a full apartment to herself. There are a lot of details that were thought through as part of the construction of our new home. Everything seemed to have worked out with this. We couldn't, unfortunately, my mom didn't have a pension or retirement that we could use. She's on SSI, and that's essentially that. She has Medicaid, Medicare, and SSI. At the beginning, when she was first diagnosed, my mother couldn't respond to the questions to help them actually diagnose where she was on the Alzheimer's or dementia scale. They didn't know which one she had. Was it one or the other? Was it a combination of both? So they decided to do an MRI and saw that, there was 30 parts of her brain that were being lit up during the MRI. And so they couldn't give her an official diagnosis. So they just diagnosed her for significant memory loss for now. She has been off of medication. She's at a point right now where she would only need a low dosage. We did have a social worker come to evaluate the level of need and care that she needs. They found out that she didn't match the criteria for in-home care, so they denied us. We finally were able to have an assessment and they did approve it. She also has life alert because I'm deaf, and I want her to be able to have, access to an emergency team, or emergency response team if something were to happen.
Has she used the life alert system?
Honestly, the only time that it's happened is that when the machine was being cleaned, it wasn't even a real emergency. She was cleaning and it accidentally hit the button and the emergency response team came up and she's like, I'm just here cleaning. But there was no legitimate emergency that has happened since she's had it. We do also have a light system that is controlled by a remote in the living room, bedroom, and bathroom. And so I want to say my master bathroom, the office, the living room has these smart lights all over that I can use to check in on my mother as well. But I want to say it's been quiet, honestly, until yesterday, the first time something happened. Ironically, I felt like it was a fire drill. But generally speaking, things to be okay right now. But what's really important is the humanity part of it. We're all human. Is there anything else that you want me to add?
No, that is perfect. Thank you so much. The second question that I want to ask all of you, I think most of you have already answered. I don't know if you want to repeat anything or kind of add any details, but there's so much information and there's so many people out here who are caregivers. And where do they go to find resources if they need support? What would you recommend as the first step for these caregivers? What advice would you give for people who are just becoming caregivers and struggling through the process? Maybe should we start with Sally? Should we start with you? Sure. Let's see. I would say that dementia is becoming a popular topic for many deaf citizens and deaf people. I think that there are resources, but we have DSA, the Deaf Seniors of America, and the last conference was in Seattle. I think it was 3 years back. And there was a workshop that was provided by a deaf psychologist, and they were specializing in dementia. It was Dr. Jamie Wilson from somewhere on the East Coast. I forgot where they were from, I'm sorry, but I know that, I was able to see 2 of the workshops. They ended up having a 3rd one, and a lot of people missed that. But at the same time, it's exciting to find out what resources are available and that there is a network of people that the DSA was able to provide within the workshop. So I'm hoping that they're able to do it again in Florida next year when they do the conference once more.
That's good to know. Thank you for sharing that, Sally. Chad, Russell, do either of you want to go? As deaf caregivers? Sure. Yeah. Obviously, I didn't have a lot of information. I got a lot of the information from the local social worker. That's where we started. And then it just progressed from there. I was hoping to have outreach to specific agencies as well, because I know that they're out there. Part of it is having to do the homework yourself to figure out what resources you have available close to your home. And being able to do that is important because you can find the specific agencies in the specific city that you live in. And that's how you'll be able to get caregivers in your area.
Chad, do you have anything to add? Yeah, when it came to the level of caregivers, again, I have a hearing mom and my entire family is hearing. And when it came to me being the caregiver, I had to coordinate with people around to have the right resources because resources are scarce, as we all know. I think what we need most is to make sure that there's a platform and that we're able to have exposure to these issues. We're able to talk about it more, and we're able to have a connection with assisted living, with nursing homes, but there's not enough of a connection as it stands right now. We have to advocate with organizations, nonprofit organizations that will provide services. And these organizations need to be put in the forefront when it comes to human services.
Absolutely.
Not only for deaf people, but also for deaf individuals who are caring for their hearing family members and loved ones. It's a challenge, for me to talk with the doctor, because, the doctor just wants to speak directly to my mother.
Right.
And I say, okay, but at the same time, you have to understand that I need an interpreter here because I am her caregiver. So, just being able to make sure that all of those situations can come together to make for a smooth process is important. Again, I think it's really important that we need to advocate and support one another. It's a tiring job.
Yeah, you had mentioned POA, power of attorney. Can somebody expand on that?
Yeah, that's power of attorney. There are lots of different things of what it can represent. So it can represent a lot of different things that you can do to support your family member. But it helped me, well, for right now, when my mom is thinking clearly, I'm able to, she's able to make all of her own decisions. But if not, then it's things that I'm able to explain later. Decisions are really the main point. We're able to assist in the decision-making process and support the person through their well-being to make sure that their well-being is all right.
Thank you for expanding on that. This is my last question before we open the floor to our audience questions, which we are getting flooded with right now. So this is my last question. Based on your experience working with doctors, nurses, social workers, and other healthcare providers, what can we do? How can we work best together to educate them on how to interact with us, to work best with deaf caregivers who are there, experiencing working with people with dementia? Do you have any advice that you'd like to share on how they could interact with us? Sure, yeah, it helps when I tell my doctor everything that's on my mind. I ask him a plethora of questions. Some of them he knows, some of them he doesn't, and then he fills me in. That was really helpful for my doctor, and that was also helpful for other healthcare workers that we worked with. Again, being here, I've been very lucky. Everybody is very open to my suggestions and they're very accepting of that. Additionally, the support group from the Alzheimer's Association was great because they provide an interpreter right away without any hassle. I want to say there was about 4 interpreters that we worked with. 2 of them worked with the dementia patient and the other 2 were for the caregivers, and they took turns. And I said, wow, there's clearly no shortage of interpreters here. But I want to say they did a pretty good job, but of course, there's always more to do.
Of course. Chad or Russell, is there anything that you want to add? This is Russell. I just support what Sally said. I agree. The key is to educating doctors first, is to notify them and inform them of the ADA. In my experience, often the doctor and the provider would want to speak directly to the patient. And I'd say, no, very often the person who has dementia is not able to answer the questions fully. They might not have the appropriate words to describe what's going on. So that's very difficult. That was challenging. Also, interpreters often, again, it's a case-by-case basis. But, my situation was always fine with the interpreters, but I noticed that, in Frank's situation, he was saying that in Philadelphia, he didn't have any interpreter whatsoever. And I think that's something that we definitely need to push for right away. That's going to be essential, because that's the way that we're going to have improvements in the future. I think it's also important for providers, doctors, and nurses to take some ASL classes, just so they can have a little bit more understanding about deafness and sign language.
Sure. And part of that example too, that Chad was just explaining was visiting the doctor with the mom and only being focused on his mom, but not on Chad. And that's a situation that we as deaf caregivers really need to, I guess, do double the work to educate the doctors, to be a caregiver, and to take that time to make sure that they're being attentive to us, to look at us, to make sure we are included and respect where we are. That sort of respect is not there unless we have to take that time. Chad, did you want to add anything to that?
Yeah, I did. Just living in a small town, and there are only 11,000 people in the town where I live. So, we do have a hospital. It's not too far from us. And there's one in the country. And then there's a bigger one that's more in the city. And so, we have to kind of decide which space we're going to go to. But I did notice that there were some issues that came up when we would go to the smaller hospital that's closer to our home. And, just the technology there, that it's just everything seemed to be lacking a bit, and it wasn't well organized. So I decided with my mom, we decided that we would go to the other hospital in the city, and my mom was fine with that. So we ended up walking out of the hospital that we were originally in, got in the car, and we drove to the larger hospital. And at that location, we were able to get what we needed. And once things settled down, we were able to, first and foremost, we were able to talk about what the issue was. We were able to see how everything was going to be impacting her, and basically being able to gather some information and educate those involved. So we explained to the first hospital that this isn't working, we're going to be going somewhere else, and they were apologetic. But we've decided to do some training, because there was some training that needed to happen. I think that it's important that doctors and nurses and people in the medical field do have the training and do have the expertise and the knowledge, knowing how to deal with deaf caregivers. And the first hospital, they actually asked us if we would be willing to fill out some feedback forms about our experience. And when I talked about being a caregiver and being a support person, when I thought about having a caregiver or a support person for me, having a support person for my mom, having interpreters, and it's a big list. I didn't want to make it about me, but at the same time, we need these resources. And right now the resources are lacking. At that time, I definitely was losing my patience, but what are you going to do? I mean, we just have to continue with grace.
A lot of us have experienced that, where we just get to the moment where we lose our patience and we just have to take a time out, go take a breath, and then come back. I absolutely agree with you, Chad. It's not an easy situation to be in. So thank you, three of you, for answering all of those questions. We have a lot of questions from our audience members. One of the questions is specifically for Chad. You had mentioned earlier about using a light system for the various rooms within the house. Can you expand on what type of light system you use?
Sure.
I use Square Glow. It's a deaf-owned business in Florida. I want to say Julio Ramirez is the one who runs it. I got all these lights and they have been amazing. They helped a lot having that. So having it again in the living room, the bedroom, the bathroom, we have different colors. So I know directly which room she's going in, again, if need be. That's what we have for now. I mean, I did have a camera set up at the very beginning when the diagnosis first happened, but then everything seemed to be okay. And my mom said, hey, I want some privacy. Can you maybe turn off these cameras? And so I haven't had them on. We haven't necessarily needed them. It's been fine without them.
Thank you for that. I have another question that applies to Sally, but obviously the other panelists are free to answer as well. The night walking issues with Paul and having him wander off. What can we do to prevent that from happening with our family members. Do you mean changing the locks or doing different things? What do you recommend for that?
Sleep with one eye open.
I wish.
Yeah. Oftentimes we would be together in the same bed and I'd wake up and just have to check on him. Sometimes if the bed was empty, I'd have to get up and run around and find him. But oftentimes he was in the kitchen, putting the food in the wrong place, and I'd find it for him. But we had to lock the doors for sure. I want to say there was a couple of times I got up and found him laying on the floor. He must have slipped and fallen. And I unfortunately could not pick him up myself. So I had to call my neighbor, who was absolutely willing to come and help pick him up with me. But again, I live close to such wonderful people. I couldn't get him up another time, and I called my daughter and she came, and we really struggled to get him up. But yeah, like I mentioned, seriously, you have to sleep with one eye open and almost hold on to them the whole night. I was very lucky that this only happened for about 2 years, not all 5 years after his diagnosis.
Russell, do you have anything to add? Honestly, I think locking the doors is really the only way in my experience. Often people with dementia, they might not remember how to unlock the door. They might be struggling with it. Or if you have multiple locks, if a deadbolt, have a lock on the actual door handle, so that they would have to go through multiple steps to get out. So that's really the best experience that I had. We also had 2 dogs. So our dogs, if he were to get up and go somewhere, the dog would follow them, make sure that they stay where they're supposed to stay. But, I think the easiest is just the locks on the door.
So that makes me think, does having pets, do you think that's a good use of maybe an alert animal if an emergency were to happen? What do you think about that?
Well, I would say that we already had dogs for several years, but we also had, doorbells and such. So, it was more emotional support for my dad. But we also had really great pets. But like I said, I think the locks on the door is really the best option. It's the best thing to do. And it's simple to add a lock to a door.
Related to that, so setting up the lights, the cameras, the locks, all of that being said, does insurance cover any of that, or is something that you have to pay for out of pocket?
Oh, goodness, no. For me, it did not. We'd have to argue a little bit with ACE, to see if we could get some support, but I highly doubt that it would cover any of that. I
Yeah,
think Paul did make his own lights, just a simple push of a button type thing. He'd constantly be pushing it on and off, but we paid for all of that out of pocket. And our house is small enough. I could basically look around from my chair and see everywhere that he might be.
so generally speaking, insurance is not willing to cover any of that? You doubt it? Okay.
No, I only used insurance for the big expensive things. The little things, I'll just take care of that myself.
Sure. I do have another question. Would you recommend long-term insurance for any sort of future caregiving plans? Is there anything that you recommend in regards to that? Sure, Sally.
I can answer that. We both had long-term care, and there were some limitations, but I was very fortunate that Paul's situation, it didn't go on for years and years. It was only for about 3 years. And I got, $3,000 a month for 3 years. And then he passed away when there were maybe about 8 months left. So there are definitely limitations to long-term care. So you need to have some type of backup. And we had backup with our retirement plan, but not everyone does. So using long-term care was beneficial.
For that type of plan, did you sit down with your family support, or did you sit down with a financial advisor, the social worker? How were you able to establish that long-term care for Paul?
That happened while I was still working at RIT. They offered that program. So we paid into that, I think for, maybe 10 years. They took money out of my paycheck each time. So it was something that I already had available and ready. So when we needed that, they did the assessment to make sure, and they gave us the money every month. So that was an RIT policy, and they helped us quite a bit.
Working at a university is nice. I'm sure there's other universities who provide that as well.
Yeah, for a while there, I thought that it was silly to be paying into that, but I was like, oh, what a waste of money. But it's the same as car insurance. It's better to be safe than sorry, to have it if you need it. So it really worked out well for us.
Absolutely. Chad, Russell, did either one of you want to add on to that? Yeah, like I said before, my mom didn't have any strong employment history. She was a single mom raising two kids on her own, and she struggled. She almost lived on the street a few times. And so her journey had been rough. So she was never able to build her own savings. It was empty. She had nothing saved for herself. So we had Medicaid, which provided some sort of resources, but she was very limited in what she was able to have. So this is where I came into the picture and really helped give her, a place to live, some place where she could be comfortable, where she was in a secure, safe environment and stress-free. And that was my goal, is that she didn't have to stress about it. Her, again, because of her level of care that she needs right now hasn't really escalated, but I'm sure the more that she progresses, the more we'll need.
Russell, do you have anything that you want to add? Yeah, the care can be expensive. So if you're able to use some type of long-term care, it's great, but it all depends on your policy. When my father received his formal diagnosis, he was walking around 24/7. And as it got closer to the end, that's when we were able to take advantage. It's a case-by-case situation, to be honest with you.
Absolutely. Okay, one last question for the three of you on our panel. What do you wish for deaf dementia patients who don't have family to support them? How can we help them through their journey?
I think the deaf community, we take advantage, we take advantage of our friends and our family members in a good way, of course. And, we talk about what's happening. And I think it's really important for caregivers to accept help from others in their community. I remember someone was saying, "Oh, I can come help." There's a boy that said they could come help, with different things. And I think if you have a deaf community in your area that is supportive, you need to allow them to support you. It's challenging.
Oh, something else that you mentioned, asking the deaf community for help, of course, but sometimes we'll admit having that, having mentioned the stigma earlier, the embarrassment, the unwillingness to share or ask for help, sometimes that could be a barrier as well. So what advice do you have to overcome that feeling of embarrassment?
Oh, I'm happy you brought that up, Smitha. I was in a very odd position. We had just moved to Portland, and I didn't know anybody. I didn't know anything about the history, in terms of like TTYs and everything else. So Paul started doing, well, we started talking about memory loss and being willing to understand what was going on. And there's no stigma about that. We felt bad that the people didn't know him. Just people knew him as he was before, and then they're meeting him now and seeing a different person. So there was an article that was written, and I thought, well, okay, this is what's going to happen. But I think that it didn't bother me. I think that you just have to go with it. You can't be ashamed of it.
Chad, did you want to add anything? You know what? I almost forgot the question. Do you mind repeating it?
Yeah, I forgot the question too.
Sure. For deaf dementia patients who don't have any family, how can we help them? Or what do you wish could be done to help them through their journey? I think, like Sally had mentioned, the deaf community has definitely increased significantly. But specifically here in Oregon, it is a very rural state. And people are very spread out. So it is very difficult making those connections. And not only that, We have to think about people who are BIPOC, their access to community resources and all of that.
Absolutely.
There's no easy answer. And I was talking with somebody about a living care facility, and we were talking about, some of the lives of dementia patients there and how that has been escalated. Some of the staff don't have the proper training. They don't have the right building. They're not equipped to handle specific dementia patients. So they have to be referred out to other facilities that specialize specifically in dementia services, but oftentimes they're all staffed by hearing individuals and hearing patients. So you have to think really hard about this. Everywhere in the US, I guarantee there has a special unit for dementia, but none of them specifically for deaf and hard of hearing individuals. Sure,
No.
nursing homes, assisted living, senior care homes, but a specialized care place for deaf dementia patients, I can't imagine there being one place anywhere in the US. Of course, it would be nice to have, but it would be a lot of work, and it takes a lot of work from all of us.
Thank you for sharing that. I completely agree. There's not just one place that we can go to get support and to learn about resources, but we need that. That is something that we need.
Come to Portland. We have it here.
All right, I'm going to wrap things up. Russell, is there anything that you'd like to add?
No, it's like what Chad said. There's no easy answer. There are no specific places for deaf dementia patients, and the resources for deaf caregivers is also very limited. So, right, it's just what everybody has been saying. It's just automatically that much harder. There's nothing easy about it. And like Chad had said, depending on where you're living, like I live in Rochester, New York, but places like Rochester, Columbus, New York City, because it is much more populated, there probably will be a lot more resources, but rural areas where you only have 1,000 to 5,000 people who live there, you're going to miss out on a lot of opportunities for resources. But again, there's no easy answer for that.
Oh, you just made me think of another question. When it comes to experience working with caregivers, do you find that people often sign or no?
My experience, no. When we had hospice, they didn't have any staff who signed.
So how did you talk with them? How did you communicate with them?
I might not be the most ethical, but we did use my brother-in-law, who is an interpreter and has been working for about 10 years. And so we were able to communicate through him. But again, it is not the most ethical, nor did we want to rely solely on a family member to do all the interpreting.
Right, but you're lucky that you had him.
Sure. And we were also able to write back and forth.
Chad or Sally?
Yeah, we were lucky
Interpreters.
to have the interpreter. Yeah. But again, that is very dependent on where you live, of course.
Mhm. Yeah, one hospice here in Salem, they have a deaf woman that works there. They don't have interpreters or anything, though. So in terms of access to information, that's not completely there. But
Oh, that's so
at the
sad.
same time, this was 3 years ago. So there was a deaf woman there. There are no interpreters, no access to information. And like Russell said, sometimes there's a family member or a friend that can come in, and hopefully that person is, aware of, advocacy and things that are going on within that particular state, but you just don't know. You don't know what the needs might be.
I have one last question that just popped up that I think would be worth asking. The question came from a social worker or a social worker case manager who is hearing. Where can we go for resources or support? Because if we want to work with deaf and hard of hearing, patients and caregivers, where can we get that support? If anybody here is interested, or if they want to provide a training, or maybe your nonprofit organization, Chad, maybe they should reach out to Gallaudet University, their, Center for Deaf Health Equity, just having opportunities for growth for hearing individuals. So if anybody would like to reach out to them, please do that. I know there is also an online training program that individuals can take that focuses specifically on training for caregivers. So take advantage of that. We can add the contact information in the chat to make that accessible for everybody. So I think that wraps up our panel discussion. Thank you so much for your time, panelists. This wouldn't be possible without all of you, and the community being able to both hear your stories and watch the film must be incredibly impactful. Tonight's conversation is not over. This is something that will be perpetuated with further dialogue in our community. This is just like what Sally said. Thank you again for all of your time. If the three of you want to turn off your cameras, that would be great.
Thank you for inviting us. Thank you so much. Oh, I don't see them now. They're gone, but bye-bye. Thank you. Yeah, Sally, you can turn your screen off. Okay, so as we wrap up here, because time is just about out, it's almost 9 o'clock, I want to close by inviting Dr. Poorna Kushalnagar back to the screen, please. I want Stacy to join us as well.
Oh, here I am.
Hello. So thank you so much, Smitha, for inviting all of the panelists and for being willing to share your story and for all of them to share their stories. I hope that the audience really enjoyed this journey tonight through our conversation as well as watching the film. Hopefully it inspired all of you to be able to support one another and to support other people who are becoming caregivers. Hopefully we'll be able to set up some type of social support group to care for one another. Maybe we could organize some type of workshop or classes. The Center for Deaf Health Equity at Gallaudet is willing to collaborate with those of you who want to establish different programs. I want to thank NAD for all of their resources. And also I see so many people from the community that are here. And I want to thank Stacy for sharing your story as well.
Oh, is this me now? Okay, I just want to make sure. I don't know.
Yeah, Stacy, you have an announcement you want to make, right? I think that your screen might have froze. But yeah, over to you, Stacy.
Yes, thank you. Yes, new information means hope. We will be able to provide more resources. Lorianne Macco did send out an email, or will be sending out an email shortly. I would be remiss to not mention some very important people who were part of this webinar. Lorianne Macco, Marissa Woodruff, the two of them who work with the RIT or NTID Alumni Relations Office. Hats off to them. We have to thank the two of them for making tonight's webinar happen. They worked tirelessly with everybody here this evening, with the team at Gallaudet. Wow. So much collaboration happened between Gallaudet and NTID. And this is a dream for many of us, for many as caregivers. I am seeing so much activity happening in the chat, and it is so inspiring. Poorna, because of her success, this project has been continuing. So the announcement that we have tonight is absolutely exciting. One of the NTID alumni, Denise Anderson, who is SVP 79, is one of 2 certified caregivers. And we are collaborating with Denise. And actually, we started talking before this webinar happened. And we asked, what would a dream training look like for caregivers? Because they need it. And so we had been talking with Dr. Kushalnagar, and wow, it was only about 15 minutes for that connection to happen with all the right people at Gallaudet. And the result of that conversation is having a formal training course that will be happening this summer.
Oh, that
So
is wonderful.
thank you so much, because like I said, now after all of this, we have hope. So thank you so much for all of your time tonight. Thank you so much, everybody.
Yeah, we have so many people who have invested in this. I want to say thank you to Christopher, who offered support, with Patrick, who offered support online behind the scenes to this webinar. There's going to be an
Yes.
email that's going to be sent out with a link to this webinar.
Yes, there will be a slide right after this where you can access the information. Thank you, everybody.
Thank you, Smitha. Thank you so much. I'm going to be turning my screen off now.